Hello, I'm Dr David Stokes, a GP here in Worthing. Today I want to talk about cholesterol, heart disease and statins, and to help you understand whether starting one might be a good choice for you. My aim is to give you the facts in plain English so that you can make an informed decision about your health. So why do we care about cholesterol? Cholesterol is a natural substance in the body. It's part of every cell membrane and is essential for normal function. But too much of it in the blood can cause problems over time. When cholesterol builds up inside our arteries, where there's been damage already, it's a bit like limescale building up in a pipe. The space the blood flows through gets narrower, and this increases the risk of heart attacks and strokes. How do we work out your risk? If your cholesterol is raised, we don't just look at the number in isolation. We look at your overall cardiovascular risk. That is the chance of you having a heart attack or stroke over the next 10 years. We use a calculator called Q-Risk, and it combines a lot of information, things like your age, your blood pressure, your cholesterol, whether you smoke, and even other conditions like chronic kidney disease, whether you have other medications like steroids or certain treatments for severe mental illness which can be affecting your cardiovascular risk. If your Q-Risk is 10% or higher, NICE recommends offering you a statin. Even if it's below 10%, it's sometimes worth a conversation to see if your risk might be underestimated. For example, if you've got a very strong family history of cardiovascular events. A question I'm often asked is, can I sort this out with diet and exercise? And the answer is really you should be trying that as well. Eating a healthy diet, staying active, avoiding smoking and having moderate alcohol intake are all vital for your heart health. But even if you do all of those things, a statin can still protect you further. The goal is to reduce your bad cholesterol by at least 40%. And lifestyle plus medication together are often the most effective way of doing that. Statins work by lowering the level of your LDL cholesterol, the harmful type in your blood. And for every 1 millimole per litre drop in your LDL cholesterol, your risk of major cardiovascular events goes down by about 22 to 25%. And the more your cholesterol drops, the greater the benefit. For example, if 20 out of 100 people like you were expected to have a heart attack or stroke over the next 10 years, taking a statin could reduce that to around 15. That's 5 people who avoid that life-changing event. Many people worry about side effects that they've read about, particularly muscle aches. Severe muscle damage is a very rare event with statins, and most people find that the aches and pains they get are caused by something else. Unfortunately, we tend to be starting this in people who've reached an age where aches and pains are quite common. And if you do get symptoms, then just talk to us. We could arrange a blood test to check that you're not getting any muscle damage. And we could look at what options we'd have to manage those symptoms if that comes up. Please do consider speaking to us before just stopping. Other safety considerations. There is a small chance that statins can raise blood sugar, which may bring forward a diagnosis of diabetes in people who are already at risk. But for almost everyone, the heart protection that it gives outweighs that small increased risk of sugar problems. Some medications like antibiotics, clarithromycin and erythromycin may interact with your statin, and so it might be recommended if you take those to pause your statin while that takes effect. Other things like grapefruit juice can also have an effect on some of these medications. If grapefruit juice is something you really live for, then let us know, because we could choose a statin which might be better for you. Statins and pregnancy. One important point, statins shouldn't be taken during pregnancy or breastfeeding. If you're planning a pregnancy, you should stop the statin at least 3 months before trying to conceive and only restart after you've finished breastfeeding. Make sure that you discuss this with your doctor if that is relevant to you. Monitoring and follow-up. We usually check your cholesterol and liver function tests 2 to 3 months after starting your statin, and again around 12 months later. If everything's stable, we won't keep repeating blood tests unnecessarily. Most people stay on statins long term to maintain the benefit, but it's always your choice, and you can review that decision at any time with your GP. Some final thoughts. If you've been advised to consider a statin, I encourage you to use the online risk calculator or the one that's been linked to you by your surgery to understand your numbers. I'll make sure there's a link in the description. If you decide you'd like to start, let your GP practice know, and if you decide not to, let them know that as well so that they can tell that you've made an informed choice. Thanks so much for watching, and if you have questions that I haven't covered here, pop them into the comments and I'll do my best to answer them in a future video. Many thanks.